Although my mother would turn to very illegitimate sources and sources that did not have peer-reviewed evidence or information, I quickly saw that the evidence and claims for myself were not accurate. And because of that, and because of my healthcare professionals I was able to speak with and the information provided to me, I was able to make a clear, concise, and scientific decision.
Seeing my mom would constantly post articles and videos and stories on social media about vaccines. I would see that people would argue on Facebook. There would be comments and threads of people saying, like, this video is not true, like, vaccines don't cause autism. So doing my own research was pretty easy. Just using the internet as a tool to find reliable sources through the CDC, WHO, Institute of Medicine, IOM, all these different places that have very reliable scientific information, all unanimously agreed that the claims my mom was making were not true.
When adolescents don't get the vaccines that they need, they expose themselves to potential illness that can develop immediately or in the near future, but also they can be exposed to illnesses that can develop later in life. When they don't get vaccines as well, not only are they increasing their own risk of illness, they're actually jeopardizing the health of those around them in their community. But we want to make sure that we can address their concerns, but also provide them with the information they need to be able to help their kids get the health care they need and to get vaccinations that are very important for their health now and throughout life.
Misinformation about vaccines is very common, and most of the misinformation around vaccines and a lot of science in general seems legitimate. And so organizations like Unity that are trying to reach out to people, get good information out there, are on the forefront of this battle and trying to get information to people that need it.